Thanks for joining us here on NewsNation Rush Hour. I'm Nichole Berlie, and COVID cases again on the rise. But is there a corresponding rise in concern? Much of the Northeast has case numbers moving upwards, with New York City officials even recommending people go back to masking indoors. But with COVID now in its third year and data showing fewer deaths, is the nation tired of hearing about any potential next wave? NewsNation's Paul Gerke joining us live now in New York City. So, Paul, what are we learning?
Nichole, New York City has raised its COVID alert level to high, which means there are 10 new hospitalizations for every 100,000 residents on a rolling average. But more than half the people hospitalized in the state of New York were not initially hospitalized for their COVID symptoms. Their diagnosis was actually discovered after the fact. It's obvious that the virus is still all around us, but as we sharpen our tools to defend ourselves from it, the question we're asking today is, does pandemic fatigue have its own side effects?
White House COVID-19 response coordinator Ashish Jha is sounding a familiar warning today that another spike of virus infections is coming.
Without additional resources, we will find ourselves in the fall or winter with people getting infected and no treatments available for them because we will have run out.
Nationwide, our current 7-day average of cases is about 94,000 per day, an increase of 26% from last week. Hospitalizations are at around 3,000 per day, up 19% from last week, but vastly fewer than during the Omicron surge. Jha admits we're much better prepared than we once were. Vaccines, therapeutics, testing, and mitigation strategies are widely available. Some people we talked to today are still concerned about COVID.
I am, very much so.
But not everyone.
No, I'm actually not. It just feels pretty normalized. I don't want to be the person to say it was a lot of hype, but I'm over it. I'm completely over it. I think almost everybody has had it at this point.
Health officials want New Yorkers to wear masks indoors and in public settings again. Compliance might be trickier this time around.
I'm not going to do it.
Cannot breathe, you do not recognize the people.
How am I going to see a beautiful smile with a mask on?
But after 2 years of this, most people at least understand the reasoning behind the ask.
I just think it's so much easier to just wear a mask and protect each other.
I have children. I don't want to expose them or my elderly mom.
At the end of the day, we're trying to keep a community safe, and it's not always about the individuals.
Regardless of public opinion, the virus is still killing people and making life miserable for a lot of COVID long haulers. In fact, a new study found that more than 3/4 of long COVID patients were not sick enough to be hospitalized under their initial diagnosis, but yet symptoms long after the fact, often months later, are still giving them trouble. Things like breathing issues, fatigue, and hypertension. Nichole?
All right, so Paul, who does long COVID really seem to be affecting?
It's actually affecting a younger demographic than you might think. In fact, 60% of long haulers, according to that new study, are under the age of 50. Nearly 1/3 had no pre-existing health conditions. Not what you'd expect.
Yeah, certainly something to pay attention to. And Paul, good thing we get to see your lovely smile today. Thank you for that. Well, thank you for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.